In 2023, Americans spent $13,432 per person on healthcare, more than twice the average of other wealthy nations. A hospital stay for a simple appendectomy costs $30,000 in the United States, while the same procedure costs $5,000 in Germany and $3,000 in France. An MRI scan that costs $1,430 in the US averages just $450 in the Netherlands. These aren't just abstract numbers, they represent real financial pain for American families. Medical debt is the leading cause of personal bankruptcy in the United States, affecting approximately 530,000 families each year. Nearly 1 in 3 Americans report skipping prescribed medications to save money, and 25% have delayed necessary medical care due to cost concerns. What's particularly striking is that Americans aren't getting better care for all this extra spending. The United States ranks last in healthcare outcomes among wealthy nations, with shorter life expectancy, higher infant mortality, and worse management of chronic diseases like diabetes. So why does the U.S. healthcare system cost so much more while delivering such disappointing results? The answer lies in a complex web of profit-driven incentives, fragmented systems, administrative bloat, and powerful interest groups that have created the most expensive healthcare system on Earth. If you want to understand one of the most pressing economic issues facing American families today, and the warning signs other countries should heed as they consider healthcare reforms, subscribe to Capital Cartography for more deep dives into the systems that shape our world. America, the price of health. To understand how America's healthcare system became so expensive, we need to look at its unique historical development. Unlike most developed nations, which established universal healthcare systems after World War II, the United States took a different path. During the 1940s, when wage controls were in place, American employers began offering health insurance as a way to attract workers. This accidental foundation, employer-based health insurance, became the cornerstone of the American system when it received favorable tax treatment from the government. By the 1960s, it was clear this patchwork system left many Americans without coverage. The government stepped in with Medicare for the elderly and Medicaid for low-income individuals, but maintained the employer-based system for most working Americans. This created a hybrid system with multiple payers, multiple rules, and multiple incentive structures. While other nations were building centralized systems that could control costs through negotiation and regulation, America was constructing a fragmented system where hospitals, doctors, insurers, and pharmaceutical companies could each maximize their own interests. Without centralized price controls or negotiations, costs began to rise. The result was a system that, by the 1980s, was already substantially more expensive than other countries, but the real explosion in costs was yet to come. Since 1990, U.S. healthcare spending has grown at roughly twice the rate of other developed nations, creating the enormous gap we see today. The fundamental reason American healthcare costs so much is surprisingly simple. Americans pay higher prices for the same goods and services than anywhere else in the world. It's not that Americans use more healthcare, they actually see doctors less frequently and spend fewer days in hospitals than citizens of most other wealthy countries. Let's look at some stark examples. The average price for a day in a hospital in the United States is about $5,700 compared to $765 in Australia. A hip replacement costs $28,000 in the US versus $16,000 in New Zealand. A common cholesterol medication, Lipitor, that costs $7 in New Zealand costs over $100 in the United States. Why are prices so much higher? Unlike other countries, the United States lacks any centralized mechanism for controlling prices. In countries like Germany, Japan, or Australia, governments directly negotiate or set prices with healthcare providers. Even countries with private insurance systems like Switzerland have government regulations that cap prices. In the US, each insurance company negotiates separately with each hospital and provider group, creating a chaotic system of different prices for identical services. These negotiations aren't conducted on a level playing field. In many regions, hospital consolidation has created virtual monopolies, giving providers enormous leverage to command higher prices. The same dynamic applies to prescription drugs. While other countries negotiate drug prices at a national level, the U.S. government is legally prohibited from negotiating prices for Medicare, the largest purchaser of drugs in the country. The result? Americans pay 2.5 times more for the same prescription drugs than citizens in other developed nations. Perhaps most troubling is the lack of price transparency. In most industries, consumers can compare prices before making a purchase. In American healthcare, patients rarely know the cost of a procedure until after it's been performed. Even doctors often have no idea what their patients will be charged. This price problem is compounded by a fee-for-service payment model that rewards volume rather than value. Doctors and hospitals are paid for each service they provide, creating incentives to perform more tests, procedures, and treatments, whether they're necessary or not. Have you ever experienced sticker shock from a medical bill? Share your story in the comments below. We want to understand how medical costs affect real people. If you've ever dealt with the American healthcare system, you've probably experienced the mountains of paperwork, confusing bills, insurance claims, and endless phone calls that seem to define the patient experience. This bureaucratic nightmare isn't just annoying, it's enormously expensive. Administrative costs account for about 25% of total U.S. healthcare spending, approximately $1,055 per person annually. In Canada, administrative costs consume just 12% of healthcare dollars, and in countries with more streamlined systems like Japan or Sweden, the figure is even lower. The United States spends nearly $2,500 per person on healthcare administration, while Canada spends just $550 per person. This administrative excess alone accounts for hundreds of billions in spending each year. Why does the American system require so much administration? The fragmented, multi-payer system is the primary culprit. Each insurance company has its own forms, billing procedures, coverage rules, and payment rates. A typical American hospital has to employ entire departments just to determine what to charge and collect payments from dozens of different insurers. Doctors in the U.S. spend about 50% more time on administrative tasks than physicians in other countries. American hospitals employ far more billing and administrative staff than their international counterparts, often outnumbering clinical staff. One study found that for every 10 physicians in the U.S. healthcare system, there are nearly 7 people working on billing and insurance tasks. This administrative burden extends to patients as well. Americans spend countless hours navigating insurance plans, disputing denied claims, and deciphering medical bills. A 2020 survey found that 73% of Americans report that understanding their health insurance is more difficult than solving a Rubik's Cube. Even more troubling, this administrative complexity creates opportunities for billing errors and fraud. The Department of Health and Human Services estimates that improper payments, those that don't meet program requirements or may be fraudulent, totaled $28.9 billion in Medicare, alone in 2019. The fragmentation doesn't just create paperwork, it creates inefficiency. Patients undergo duplicate tests because records don't transfer between systems. Doctors spend valuable time on insurance paperwork rather than patient care. The system wastes both money and human potential. Unlike healthcare systems in most developed nations, the American system is predominantly profit-driven. While there's nothing inherently wrong with making a profit, the incentives in healthcare can distort priorities in ways that drive up costs without improving care. American hospitals, which were predominantly nonprofit institutions until the 1980s, have increasingly consolidated into large, often for-profit systems that command higher prices. Since 2010, there have been over 750 hospital mergers in the United States, reducing competition and giving these consolidated systems tremendous pricing power. Insurance companies also operate on a profit-driven model. The largest insurers report profit margins of 3 to 5%, which might seem modest, but translates to billions of dollars annually. Insurance companies have incentives to deny claims, restrict coverage, and raise premiums whenever possible. Pharmaceutical companies represent perhaps the most profitable sector within healthcare. The average profit margin for large pharmaceutical companies is approximately 20%, significantly higher than most other industries. These companies spend more on marketing than on research and development, and they aggressively protect patents to prevent generic competition. The profit motive extends to physician compensation as well. American doctors earn substantially more than their counterparts in other wealthy nations. Specialists in the U.S. earn an average of $350,000 annually, compared to $150,000 to $200,000 in other OECD countries. While higher education costs in America partially justify higher salaries, the difference is still substantial. Even more problematic are the incentive structures in American healthcare. The predominant fee-for-service model pays providers based on the volume of services they provide, not the outcomes they achieve. This creates incentives to perform more procedures, order more tests, and schedule more appointments, whether they benefit patients or not. The medical technology and equipment industries also drive costs upward. New devices and technologies enter the market at premium prices, and hospitals compete to offer the latest equipment, even when the clinical benefits over existing technologies are marginal. This medical arms race drives up costs without necessarily improving care. Do you think healthcare should be treated as a business, or is it fundamentally different from other economic sectors? Share your thoughts in the comments. Despite spending far more than any other nation on healthcare, the United States is the only wealthy country without universal coverage. Approximately 8.6% of Americans, over 27 million people, lack health insurance entirely. Millions more are underinsured, with coverage that leaves them vulnerable to catastrophic costs. This coverage gap doesn't just affect the uninsured, it drives up costs for everyone in several ways. First, uninsured patients often delay care until conditions become severe and expensive to treat. When they can't pay, hospitals shift those costs to insured patients through higher prices. Emergency departments, which cannot legally turn away patients, become de facto primary care providers for the uninsured, at 5 to 10 times the cost of regular doctor visits. This inefficient use of resources drives up overall system costs. The lack of universal coverage also means Americans change insurance plans frequently when they change jobs, move to a different state, or experience income changes. This churning creates administrative costs and disrupts continuity of care. Patients start over with new doctors, repeat tests, and face gaps in treatment during transitions. For those who do have insurance, the complexity of the system creates additional costs. The average American can choose from dozens of insurance plans with different networks, deductibles, co-pays, and coverage rules. Companies spend billions on marketing to differentiate largely similar products, and consumers spend countless hours trying to navigate this bewildering marketplace. The insurance system also imposes significant costs on employers. American businesses spend an average of $15,000 per employee annually on health insurance, costs that their international competitors don't face. This puts American companies at a competitive disadvantage in the global marketplace. Perhaps most significantly, the lack of universal coverage has prevented the U.S. from using the main tool other countries employ to control costs: the negotiating power of a single buyer or regulator. When a country's healthcare system covers all citizens, it can negotiate lower prices for drugs, devices, and services. The fragmented American system lacks this leverage, allowing providers to play insurers against each other to command higher prices. America's healthcare system struggles not from lack of understanding, but from powerful interests and political divisions blocking solutions. Several pathways exist: implementing price controls like Maryland's successful model, simplifying administration to reduce billions in costs, shifting to value-based payment systems, expanding coverage for better preventive care, and increasing transparency. The United States has everything needed to create excellent, affordable healthcare, but lacks political consensus to overcome entrenched interests. Americans pay more, not for better care, but because the system prioritizes revenue over value. Real solutions don't require radical change, just the courage to learn from successful models at home and abroad.